I'm here in the steamer lobby of the St. Paul Fire Department for this month's Regions EMS update. This historic steam fire engine behind me represents well over 100 years of tradition for the United States Fire Service. We have a lot of catching up to do in EMS as we develop our own history and tradition, but we can definitely be proud that a lot of that work is being done right here in our area through the selfless dedication of people like you. Speaking of traditions, this is now our second regular EMS update. Not exactly timeless, but every streak starts with 2. Coming up, aspirin, Narcan, and some important guideline updates. For this video update, those are the 3 things you need to know. Hi, I'm Dr. Peterson with Regions EMS. Modern EMS doesn't have a lot of tradition yet, but what we do have is rooted in advanced cardiac care. EMS really shines in time-sensitive situations. One of the most common reasons for a 911 call is for chest pain. You respond emergently, get a 12-lead EKG, have the patient chew some aspirin, and maybe give a dose of nitro or 2. It's a pretty safe bet that EKG will be normal, and a pretty good chance that nothing serious is wrong with the patient. So why do we take this so seriously? Because heart disease is the leading cause of death in the United States, and we have the ability to do something about it. So here's what you need to know. Coronary artery disease is caused by the gradual buildup of cholesterol plaques inside of the heart's blood vessels over time. One of 3 things can happen. The plaques may never cause problems, and the person dies of something unrelated to their heart disease. The plaques continue to build up, and eventually the blood flow is limited through the affected blood vessel, or the plaque may suddenly rupture, causing a clot to form in the artery. If the EKG shows ST segment elevation in a specific pattern, the decision is easy. But if the EKG is normal, the important thing to remember is that a normal EKG does not rule out an acute cardiac event. It's only one piece of a complicated puzzle. We try to fill in more pieces of this puzzle in the ER, but even then we sometimes don't have enough information to make a definitive diagnosis. All of this takes time, but the underlying problem is time sensitive. Of all the medications we give and things we do to patients with chest pain, it's actually pretty simple. Aspirin is the only thing proven to make a difference. The clot blocking the blood vessel is formed around platelets. So what does aspirin do? It disables the platelets. For every 100 patients that you give aspirin to, at least 2 lives will be saved because you gave aspirin. Did you catch that? That's 2 deaths that were prevented because you gave aspirin. Even better, you would have to treat more than 167 people before you would even begin to see some of the minor negative side effects of aspirin. Aspirin is one of the safest and most life-saving interventions we have on an ambulance, and there's no reason not to give it to anyone with chest pain, even if they're already on blood thinners. Unless someone truly has an allergy to aspirin, there's absolutely no reason not to give aspirin. Take-home points. Either give it, document why it wasn't given, or document that it was taken prior to your arrival.
Starting your day on an important note. Did you know that during a suspected heart attack, calling 911 and chewing aspirin could help save a life? The problem is, there isn't always aspirin around. Bear wants to change that with a little help from an exceptional group of folks. Can the people with the most common last name help save lives?
Let's talk about Narcan for a minute. The following video summarizes the important things to understand about Narcan. Even though it's Canadian, everything applies to the United States as well. So watch this.
In Canada, naloxone is now available from pharmacies without a prescription. Naloxone is a temporary antidote for overdoses from opioid drugs. Here are 5 things everyone should know about naloxone. Number 1, opioid overdoses are rising quickly in Canada. People can overdose on prescription opioids, such as oxycodone, or illicit opioids, such as heroin. Sometimes illicit drugs are also laced with potent opioids like fentanyl. 2. The times someone is most at risk of overdose include when they start using opioids or switch to a different opioid, when they buy an opioid from a new or unfamiliar source, when they restart drug use after getting clean in rehab or jail, and when they mix an opioid with another depressant, such as alcohol or a benzo. 3. Naloxone is usually injected into a muscle. Each dose of naloxone lasts for a short time, about 30 minutes. When someone is overdosed, naloxone buys time for the ambulance to arrive and get the person to hospital. 4. Naloxone is a safe drug, but it does have some side effects. When someone uses opioids for a long time, naloxone can cause fast and strong withdrawal symptoms, including irritability, anger, sweating, shivering, muscle pain, throwing up, and diarrhea. And finally, 5. Remember that naloxone is a temporary antidote. If the person is not taken to hospital, they may fall back into the overdose within a half hour. If someone you know is overdosed, it's important to call 911, even if you give naloxone.
For this reason, it is important to transport every patient who receives Narcan to a hospital. They could be placed on a transport hold, so get law enforcement involved early. We have had several deaths in the Twin Cities from a relapse after Narcan, so we take this very seriously. To wrap up this month's Regions EMS update, let's focus on a few guideline items. The new normal state of operations seems to be some degree of medication shortage. Currently, we're dealing with shortages of D50, epi preloads, calcium, and sodium bicarb. We expect the supply of D50 to improve soon, but we're considering a permanent switch to D10 for reasons I discussed in last month's video update. The epi shortage is a bigger deal. As some of you have noticed, we've had to create an epi kit with a 1 ml vial of 1 to 1000 epi, a 10 ml vial of normal saline, and a 10 ml syringe. You have to dilute the 1 to 1000 epi with 9 ml of saline to create your own 1 to 10,000 epi dilution. A little inconvenient, but somehow I'm confident that humanity will persevere. Calcium and bicarb really don't have any other options, so unfortunately if it's not available, there's not much we can do about it. We have regular updates from our pharmacy supplier, so we'll keep you posted as things change. The last thing you need to know is that pericardiocentesis is no longer in the Regions EMS guidelines. There is no evidence to support the practice of this procedure, and without ultrasound guidance, there are several potential complications that could arise, which by themselves could each be fatal. Draining blood from the pericardial sac does not do anything for a hole in the heart. This procedure is no longer practiced by any EMS system in the metro area, and the kits should be removed from your ambulance. It's just not a procedure that has any clinical benefit and carries significant risk. That's it for this Regions EMS update. Please let us know if there's topics you'd like covered in future updates. You can contact us through our website at regionsems.com or at our Facebook page, facebook.com/regionsems. Special thanks to St. Paul Fire and Assistant Chief Simpson for hosting us this month. On behalf of Regions EMS, be smart, be safe, and be professional. Thanks for watching.